It's great to be here. Thank you all for joining us this morning. This is really like to thank the LSI team. This is, I believe, my fourth or fifth meeting, and it's great to be back. I'm Lishan Aklog. I'm the chairman and CEO of Lucid Diagnostics, and I'm going to talk today about esophageal precancer testing, a breakthrough in cancer prevention. Before this session is over, 40 individuals in this country will be issued near-death sentences at the time of an endoscopy. 10 of them will be dead in 1 year, and only 8 of them will still be alive after 5 years. So what is this ruthless killer? It's esophageal cancer. It's not one that we don't speak enough about. 21,000 patients were diagnosed with this last year. The incidence has increased 500% over the last 4.5 decades or so, by far outstripping every other cancer. So what if cancer could be prevented? We talk a lot about early detection. We've had great success with breast and lung and prostate, but that's all early cancer detection. That's not prevention. There are really only 2 modalities that actually prevent cancer. One is Pap testing and one is colonoscopy. Those have worked, so mortality rates have declined substantially in those areas, but we have many other cancers, including esophageal cancer, which I include in the deadly 3, the 3 most deadly cancers, that we don't talk about enough. And that's despite the fact that more people last year died of these 3 cancers than colorectal and breast cancer combined. I'm a physician. I was actually shocked by that number. And the important thing about these is that they have a high early stage mortality. Stage 1, detecting it early is not a win because they have a high mortality. You need to do precancer detection in order to prevent cancer in these cancers, including esophageal cancer. The good news is we don't have much going on in pancreas. We don't have much going on in the liver right now, but we do have now a solution for esophageal cancer. So esophageal cancer can be prevented because we can detect esophageal precancer now. So what's our company? Lucid Diagnostics is a NASDAQ-listed public company. We're commercial stage. We're in the cancer prevention space, focused on early precancer detection. And our mission is simple. It's to prevent those 16,000 esophageal cancer deaths in at-risk patients using our technologies. A few highlights. We have a high-margin asset. We have a massive market opportunity. We have a well-honed and well-established multi-pronged commercial strategy. We have operational excellence in our field team and our laboratory team. And we have world-class leaders and a board and directors. I'll highlight 2 at the bottom there. Stan Lapidus, the founder of Cytech and the inventor of the original Pap test. Any of you who are in the diagnostic space know Stan. He also was the founder of Exact Sciences. Nick Shaheen is the leading esophageal gastroenterologist in this country. He is the lead author of the guidelines in this space and the head of our medical advisory board. So what is EsoGuard? EsoGuard is a DNA test. It's the first and only commercially available test that can serve as a widespread screening tool to prevent these deaths through the early detection of esophageal precancer. A key adjunct to it is a cell collection, very clever but simple cell collection device that, as an alternative to endoscopy, allows the collection of cells from the lower part of the esophagus where this pathology occurs in less than 2 minutes in an office, no anesthesia, no sedation. It's got the clever technology you can see there. It's a capsule attached to a balloon that can inflate and deflate. It basically allows you to swab the lower esophagus, but to do so in an anatomically targeted way and also in a protected way, so it's not contaminated by cells in the upper esophagus and the mouth. So the cycle is, if you start on the left, the clinician collects this sample in an office setting. A specimen is sent to our central laboratory, which is just 10 minutes up the street here in Lake Forest, and a positive or negative result is returned. I don't have a lot of time to go over all of our data, so I summarized it here to sort of talk about our performance relative to something we know a little bit more about, which is colorectal screening, and there's more attention to that. So if you think of wildly successful tool in stool DNA testing, Cologuard, a lot of interest and excitement right now for blood tests, for liquid biopsy tests from Guardant, and as you can see there on the left, with cancer, we do really well. We have a 96% sensitivity for esophageal cancer, comparable to those. As you get to the liquid biopsy side, you start to lose, especially early stage. The key differentiation starts to happen as we get to precancer. So in the precancer cases, still high sensitivities in the high 80s, negative predictive values of 99% approximately, and the other tests start to fall off. And most notably for early precancer, there is no other molecular diagnostic test that can detect an early precancer with any sensitivity. Cologuard, 0, Guardant, 0 in those situations. And we have a solid positive predictive value as well. Who should be tested? No controversy here. It's well established in guidelines who should be tested. You can see here there's 7 risk factors. Many of you in the room would probably qualify for this. It includes heartburn and 3 out of those remaining 6 risk factors. All 3 major GI societies have endorsed this, and they've added non-endoscopic biomarker testing to it. So how big is the market? There are 30 million patients who satisfy the most conservative of those. We have Medicare payment established at $1,938, so this is a massive market opportunity. It's over $60 billion. And we've already established a 90% gross margin at our current volumes. We've been working for several years on a multi-pronged commercial strategy. We have our own physical locations where we do testing. Our own clinicians do it. We send clinicians into physicians' offices, sort of like phlebotomists go to and park themselves in a physician office to do testing. We have physician practices that do it themselves. We have mobile testing units in Florida. And we have one of the more exciting parts, we have these health fairs like at fire departments where there's a high incidence of cancer where we can go in and test 100 firefighters over several shifts in a day. We've been steadily growing test volume over the last couple of years, and we're now at a level where we have a critical mass of test volume that can generate claims history and sort of advance us along the path towards predictable reimbursement. So what have we accomplished and what are our near-term goals? We've accomplished a lot. We really checked a lot of the boxes here. Our sales and marketing processes produce high adoption and physician yield. As I mentioned, our acquisition strategy is multi-pronged and works well. We are able to train people to do the cell collection test with 99% technical success. Our laboratory operates really well. We have an NGS facility with high efficiency of the assay. And as I said, we've gotten our costs down, our COGS down, so we now run at a 90% gross margin. We've been publishing clinical evidence, substantial clinical evidence over the last year, 4 clinical validity studies, 3 clinical utility studies that are either in print, published, peer-reviewed, or on a preprint server. And we're working our way through the last hurrah here, which is reimbursement. So we have excellent revenue cycle management with Quadex. That price is holding, the Medicare price is holding for us, even in our out-of-network payments. We're building a market access team. We've hired some new folks, and we're plowing ahead on medical policy coverage with both commercial payers and with CMS. There's a MolDX foundational LCD that covers these category of tests, and we're working our way to submit a technical assessment for that. We're really excited about a major initiative we've launched. We've just started to dabble in it. We've signed 1 contract to prove this as a concept of offering a molecular diagnostic test as a covered health benefit within your health and wellness program. And it's something that other diagnostic companies have done, and we're really excited about the prospects of that. So we've been around for a while, but we are actually still raising money. We closed a PIPE last week, and so there's still opportunities to come in at the early stages here. Some of the highlights there in our investment thesis, and I will close there. So thank you for your attention.